The following is a special presentation of Keeping It 100. Watch future episodes exclusively on Soul of the South, available over the air on 30.4, or contact your local cable provider.
Good day, and welcome to Keepin It 100. I'm Michael Victorian, your host and president of the 100 Black Men of Metro Baton Rouge. Today our topic is the Affordable Care Act, also known as Obamacare. In the first term of his presidency, President Barack Obama and Congress passed the Affordable Care Act, a law designed to help all Americans access quality and affordable health care. Several Republican governors challenged the law. The case eventually reached the Supreme Court, which made two pieces of the law optional for states, expanding Medicaid eligibility and creating health insurance exchanges. The Affordable Care Act remains one of the most debated laws in the nation. Republicans in Congress have voted over 40 times to block the law, and some are considering funding the government to stop it from being implemented. Now, here to keep it 100 about the Affordable Care Act are Mariba Karamoko, director of the Louisiana Healthcare Coalition, and Jonathan Chapman, executive director of the Louisiana Primary Care Association. Let's get into it. Mariba and Jonathan, could you tell us a little about yourselves and what your organizations do, please? Oh, and by the way, thank you for coming today.
Glad to be here. I live and work out of Baton Rouge, out of Breaux Bridge, Louisiana, and I head a statewide organization, the Louisiana Consumer Healthcare Coalition, and we seek to represent the interests of consumers in all things healthcare. If you look at a piece of healthcare legislation, if you look at a piece of healthcare policy, whether it's a public policy or a private hospital policy, there's a consumer angle to it, there's a provider angle to it, there's an insurance angle. We advocate on behalf of the consumers. We try to make sure the consumer voice is articulated in those issues and to provide resources and information helpful to consumers who are seeking to make better use of the healthcare system.
Thank you very much. Jonathan?
Yes, thank you for allowing me to be here. I serve as director of the Louisiana Primary Care Association, and we represent the 28 federally qualified health centers across the state, or commonly referred to as FQHCs, who operate over 100 service sites across the state. And we are providing primary care, behavioral health, and dental services to all, regardless of their ability to pay. So today's topic is very relevant, not only to us as an organization, but certainly to our patients.
Okay. Now, if each of you could give me the major highlights of the Affordable Care Act, please.
Well, one of the most important parts of the act, in my opinion, is the changes that it is bringing and has brought to the regulation, the marketing, and the operation of the private insurance market. Prior to the Affordable Care Act, for instance, you could be denied health care coverage. Okay. You could be denied insurance simply based on a prior condition, okay, a pre-existing condition, right, whether that be a substance use disorder, acne, having complicated pregnancies in the case of a woman. That's no longer allowed.
Okay.
So all of the money in the world at a certain point couldn't help you prior to the Affordable Care Act if an insurance company decided to deny you coverage. So that can no longer happen. Also, if you buy an insurance policy now with the provisions of the Affordable Care Act, it's what we call guaranteed issue and guaranteed reissue. An insurance company cannot cancel your policy once you've gotten sick. If you pay your premium, you buy a policy, you can keep that policy now as long as you're able and willing to pay the premium. I think those are very, very, very important elements of the law.
And those are two very critical highlights. Jonathan,
Absolutely.
could you share some additional
Sure.
information on the highlights of the
Right.
Affordable Health Care Act?
And I totally agree with Mariba. I think those are really the true highlights in the fact that this coverage is guaranteed. And the act itself kind of lends itself to the Affordable Care Act, that we are attempting to provide affordable health insurance for all. Now, this goes beyond just health insurance, but certainly why someone would carry health insurance. That's for the sustainability of their family, the sustainability of their family's finances. So the format and the way the act is rolling out and the implementation, it does really take into account a person's position, whether it be by income or by geographic location. So I think that they've covered pretty much, excuse the metaphor, covered all the bases, in fact, in trying to reach every single resident in the United States.
Okay, thank you. Now, guys, the next question I'd like you to share with us information on is, how does the Affordable Care Act impact people who currently receive health insurance from their employer? Can they remain on their employer's provided plan? And will that cost increase or decrease?
Anybody who currently has employer-sponsored coverage can remain on that coverage if they choose. The law does not force or dictate that someone who currently has employer-based coverage leave that coverage for government-sponsored Medicaid or government-subsidized private insurance in the health insurance marketplace. So 75 to 80% of people who are currently getting insurance through their employer will see, for them, no real change. Now, their employer may see some changes, and some of the changes that their employer will see may cost the employer additional money. For instance, unless it's what's called a grandfathered plan, a plan that's exempt, a group plan that's exempt from some of the provisions, a policy that did not have comprehensive prevention will now have comprehensive prevention and wellness. The insurance carrier for that.
Could you do one favor, just hold that thought? We're going to take a quick break and we want to come back to it because that's a very important issue. We want you to finish that up and then we'll get back with Jonathan. We'll start right back off with you. Mr. Karamoko, you were discussing how the Affordable Care Act will affect employer plans. I'd like you to continue that.
Right. The Affordable Care Act, again, doesn't dictate that anybody leave an employer plan. And it does not necessarily force increases in the costs associated with employer plans. However, there are provisions of the Act that improve coverage in employer plans for employees. And whether that cost is reflected for the consumer is a decision of the company and the carrier, the insurance company, the employer associated with that plan. For instance, we now have comprehensive wellness benefits that the Affordable Care Act dictates. Major cancer screenings, some nutritional and dietetic wellness stuff. It's up to an employer and an insurance company whether they absorb that cost or whether they pass that cost to the consumer in the form of a premium increase. The government doesn't dictate how they handle that. A number of companies have already made those changes and consumers haven't seen any premium increases. Other companies made the changes and passed the cost associated with it on to the consumer. But the thing I remind all consumers of is, if you stop and think about it and you've had employer-based coverage for 15 or 20 years, at least 3/4 of that time, you've had a premium increase.
Correct.
So premium increases are not new. The difference with this premium increase is you're getting more services.
Okay, thank you. Jonathan, would you like to share
I
with us?
think, again, he covered it quite well, but again, just to say that it does not require you to leave your employer-sponsored coverage. And then certainly when you go through I guess the applications, it does inquire whether or not you currently have employer-based services. And as he mentioned, that there are grandfathered plans that will enable you to stay with your current plan. You may not be guaranteed all the same services, but they certainly over time will increment into full coverage.
Thank you very much. Now, guys, the next question. The Supreme Court gave states the option of expanding Medicaid eligibility. Now, under the Affordable Care Act, can you describe what this means in lay terms, and especially what are the impacts to Louisianians?
Well, this was, I'll go ahead and jump off
Yeah,
to
if
this
you don't
one.
mind.
Sure. As you can imagine, this was quite a hot topic when the Supreme Court did rule that each state had the individual option of expanding Medicaid under their provised or proposed rules, or to go along and just keep their, I guess, Medicaid programs status quo, if you will. In Louisiana, our government, our administration chose not to expand Medicaid under that provision. And, I think that there was quite a bit of legislative activity considering going forth and actually proposing such expansions that were not successful.
Okay.
Now, one of the things that it means for Louisiana when the state exercises its option not to expand Medicaid coverage is that a significant segment of working families in Louisiana will continue to not have any comprehensive health coverage. Medicaid expansion would have given men and women that we encounter every day as restaurant employees, landscapers, gardeners, retail service clerks, people who are working in low-wage, medium-wage jobs where they either have an employer who's too small to offer coverage. A number of small businesses can't absorb the cost of coverage, or their wages can't absorb the cost of coverage. Medicaid expansion was a way to bring coverage and access to health care to these families in Louisiana. They essentially are cut out. These are people who are making $7.25 to $15 an hour. Do the math on that and try to have 30% of your income chewed up by healthcare expenses. It gets to be very difficult.
Exactly. Now, did you have something
I
to
just
say?
wanted to add, in 2012, our health centers across the state, 75% of our patients were below 100% of poverty level. So this affects 3/4 of our patients across the state, which is 200,000 people.
Wow. So that brings me to the next question. How can people who don't qualify for Medicaid receive assistance in paying for health care?
Well, the federally qualified health centers that the LPCA represent, we do provide health care regardless of ability to pay or insurance coverage. So these facilities and these services will continue to be offered to these patients across the state. If you do not have insurance, Medicaid or private insurance, you come in and there's an income verification process, and then there's what's called a sliding fee scale. So we base the fee on your level of income. So no one is refused.
Okay. Mariba, can you share with us?
Well, I think if it was not for the federally qualified health centers that Jonathan represents, as well as to some degree the charity healthcare policies of private hospitals and the charity hospital system, which is going through major transformations, we would have a much bigger gap in our healthcare delivery system by not doing Medicaid expansion.
Probably the next question I'd like to find out is what are the health insurance exchanges? And how can people in Louisiana use this exchange to compare and purchase health insurance?
Sure, it's it's very much or very similar to shopping online for other products. Starting October 1, you can go to healthcare.gov, and there is an online application. It'll be available in English and in Spanish, and you go through a series of questions, and it will determine for you those plans that are most appropriate for you and or your family. Right now, there are 4 companies that intend on offering plans in Louisiana. It depends really on your level of income and your geographical residence.
All right. Jonathan, we're going to take a break, but we want to get back to this because that's very key so we can share more about these exchanges. To our viewing audience, we'll be right back. Thank you for joining us, and we'll be back in a few minutes. Welcome back. Jonathan, you were sharing information on the exchanges and how can people in Louisiana use the exchanges. If you can continue that for us, please.
Sure. The marketplace or the exchanges are places that you can go online to actually apply for health insurance for those that are income levels between 100 and 400% of federal poverty level. As Mariba was talking about, that is really the working class and those that may certainly have occupations and income, but may not have employer-based insurance. Again, there is lots of different websites and documents out there that will provide consumer assistance. One being what they call the Patient Navigator. There are 4 groups in Louisiana that have been funded to actually hire staff and go through a certain training process that will help consumers where they work, stay, play, and prayer. That's kind of the tagline for those. And there's also what's called the Certified Application Counselors. These are nonprofit, typically nonprofit organizations that have reached out and applied and will also train staff in providing personal patient assistance in doing these applications. These organizations or these trainers or assisters, if you will, they'll be listed on the healthcare.gov website. You can simply put in your town or your zip code, and it will provide a list of those organizations, their locations, for you to access them.
Thank you very much. Ms. Karamoko, could you?
The other thing that I think is very important about the marketplaces, as they're now called, is the fact that you're getting quality insurance coverage. And it's made affordable by the fact that the government steps in, the federal government steps in and pays a portion of your premium, depending on your income, in order to keep your premium from chewing up a significant part of your income. To keep it affordable, the government subsidizes in the form of a tax credit a portion of your premium. So if you're making between, say, roughly $20,000 a year, you can look forward to a premium of $2,800 to underwrite, a tax credit of $2,800 to underwrite the total cost of your premium. Now, you'll also hear a lot of conversation about penalties, that if you don't have coverage, you're going to pay this penalty. While that is true, the penalty pales in comparison to the benefits one leaves on the table if they do not take advantage of the tax credit. Instead of a $2,800 tax credit, if you decide to go without coverage, you don't buy the coverage in the health insurance marketplace, you'll pay a fine. You'll pay a penalty of $103.
Annually?
That's it, $103 versus a tax credit of $2,800 for a comprehensive health insurance package. So I encourage consumers, do the math.
Thank you so much. Now, with the delays expected around the Affordable Care Act, how will this affect the medical service providers? And in addition, are we fully prepared for the results?
Well, as far as the delays, the only one delay that I am aware of thus far are for those employers with greater than 50 employees. Regardless of that, we are moving forward with implementation. The open enrollment for the marketplace begins October 1 with coverage starting January 1. And we're certainly aware of several other Affordable Care Act provisions that are also still slated for a January 1, 2014 start.
Okay.
Most private providers won't see any adverse impact from the delays that the government has announced with respect to employer mandates. those will affect employers, and they affect employers positively right now. It gives them another year to come into compliance with provisions of the law.
Okay. Now, the October 1, which is a couple of weeks away, okay, if you could take a minute and to the viewing audience, what are the initial steps that individuals in the viewing audience start to take now, because October 1 is just a few weeks away?
Right, and my thing is, programs such as this that get the word out, simply the basic information, the fact that you're aware that October 1 does open the enrollment, and you can go online at healthcare.gov starting October 1st and open up an account and begin the process of application. There are certain questions that you may want to do some research or some homework on and make sure that you provide adequate and correct information, and then look forward to that January 1 coverage date.
Ms. Karamoka.
I encourage families to take a look at their finances. Just get a tax return from last year to give you something as a baseline. Pay attention to what's on your line 37. That's your adjusted gross income. That's going to determine whether you're eligible for tax credits or not. And begin to try to figure out how much can you afford to invest in a health insurance premium. That way, when you go to the marketplace website, you'll have several options presented to you, and those options will be very detailed with respect to the cost of the premium, the cost of the co-shares, and what have you. And if you have that information, you can make a strategic decision much quicker and easier, and the navigators and other groups that are positioned to help you, like Jonathan's association, that's the kind of stuff that gives them more to work with.
Okay. Thank you very much. Mariva, Jonathan, we'd like to thank you so much for joining us today. This concludes our program. We're running out of time. We'd love to continue. We want to thank the viewing audience for tuning in to our segment of the Affordable Care Act. We thank you today, and remember to watch next week, and always keep it 100.